Hi, good morning. I'm Steve Warner. I'm the invigilator for the OET test conducting on 28/04/2020. May I know your name, please?
Hi, good morning. My full name is Ronnie Parker.
Can I have your passport, please?
Yes, sure.
Can I have your candidate number, please?
My candidate number is 156792.
All right. We can now begin the warm-up session. What do you find difficult about being a nurse?
I think the most difficult part of being a nurse is when I have a patient who is very unhappy or in a lot of pain, and I can't comfort them to the degree I'd like to. I keep a dialogue going with the attending physician so that she has as much information as possible regarding the patient's pain level. Sometimes the patient doesn't effectively communicate with the doctor, and I try to help bridge that communication gap.
Do you prefer to work alone, or as part of a team?
Nurses often need to do both, work independently, and also collaboratively. That depends on the circumstances. I enjoy being part of a treatment and support team, but I also like the autonomy of working alone.
How would you handle a patient who complains constantly of pain?
I would listen sympathetically to the patient's complaint, and reassure the patient that his or her concerns were being heard and that we were doing everything possible to help. If it seemed warranted, I'd confer with the attending doctor to make sure that the patient's pain was being managed in the most effective way.
What do you contribute to your patients as a nurse?
I feel that my patients know that I am there to provide comfort and understanding, that I will listen to their concerns, and that I will act as their advocate if necessary.
How would you deal with a doctor who is rude?
Everyone has bad days. If the rudeness is a one-time occurrence, I'd let it go. If something major happens, or if it's repeated, I'd reach out to my supervisor. My concern would be that perhaps the doctor was being rude not because of a bad day, but because of dissatisfaction with my work.
That's the end of the warm-up session. Now we can move on to cue card sessions. I'll help you with the task questions. This is your task card. You have 3 minutes to prepare with the task card. Your time starts now. All right. Your time is up. You can now start the roleplay.
Good morning, my name is Ronnie, and I am one of the registered nurses in this facility. How may I address you?
Hi, you can call me Sarah.
Nice to meet you, Sarah. How may I assist you today?
Actually, I face many problems. But for now, my major trouble is that I always have a urinary urgency.
Before proceeding further, I would like to ask you some questions to get a detailed picture of your situation. Would that be okay?
Okay, you can proceed.
All right. Since, how long have you had this problem?
I am not remembering the exact day or date. But if my memory is good, then it was 4 weeks ago, I believe.
Okay. Could you please tell me the frequency that you use the bathroom in a day?
Oh. It's a lot. I feel like I am always there in the washroom. To be clear, once every 2 to 3 hours.
All right. So, whenever you had the urge to urinate, were you able to hold it comfortably for some time?
Really, it is not possible. I got a desperate urge.
I can see that must have been hard for you.
Yes, I feel really hopeless.
It's a pity to hear that.
Yes, my condition is really pathetic.
Can I ask a few more questions regarding your urgency?
Sure.
All right, so, how often do you rush to the bathroom with a sudden urge for urination?
Well, from last few week. About 2 to 3 times a day.
All right. I am afraid I need to ask you a personal question. May I proceed?
Yes, continue.
Has there ever been a time when you get a strong urge to empty the bladder, and you could not get to the bathroom fast enough?
Yes. I usually rush as fast as I can. I try. But,
yes. Go on speaking. Don't feel embarrassed. I am here to help you.
On some bad days, I fail to reach the toilet, and it leaks.
I can see that this has been very difficult for you to cope with.
Yes. It's irritating, and frustrating me a lot.
I can sense how angry you have been feeling about your illness. Have you ever sought any medical management for these?
No, I haven't. I thought that it might be due to my age. And it's so embarrassing for me to talk about it.
Thank you for telling me how you have been feeling. Could you please tell me what all kinds of changes has it had on your lifestyle?
Oh, it changed my life completely. Now, because of the fear of leakage, I won't attend any social events or distant travel. Moreover, I even stopped doing exercises because of this.
I appreciate you telling me this. It helps me in understanding the situation much better. So, to reiterate what we have discussed so far, since 1 month, you have had an increased frequency of urination along with an urgency to urinate occasionally. The symptoms have gradually worsened, and you urinate every 2 to 3 hours and have urgency 2 to 3 times a day. At times, the uncontrollable urgency leads to leakage of urine on the way to the bathroom. This urgency and leakage of urine has affected you negatively, and is holding you away from socializing and exercising. Is that an accurate summary? Is there anything else that you would like to add?
No. That's pretty much. Oh, I forget to say that I have been restricting my fluid intake ever since I started to experience the symptoms. I am scared that it will deteriorate my condition, and I really don't want that to happen.
So, do you mean you haven't had any fluid at all?
Oh no, I mean I just have sips of water when I feel thirsty.
Oh. That's too difficult. Based on our today's consultation, I believe that you are suffering from urgent incontinence. Do you have any idea about this before?
No. I am not sure. Is it an emergency state? Are there any treatment options available?
Urinary incontinence is a common problem that affects many people. It is more common among women than men. An estimated 30% of females suffer from it. It happens when there is involuntary leakage of urine from the bladder. It means a person urinates when they do not want to. Its prevalence increases as people get older. That being said, let me assure you that it is easily treatable with medication and several treatment options. And it is not something to be alarmed about.
Okay, so, what are the treatment options available for me?
In addition to the medication, you all need some further management such as bladder training and pelvic floor muscle exercises. For this, I would advise seeing a urologist who specializes in treating incontinence of the bladder. Would it be okay if I can schedule an appointment for you tomorrow at the same time?
Thank you. That will be great.
Meanwhile, I suggest you to use disposable undergarments and continence pads in order to manage the leakage trouble. So that you need not to worry about socialization and travel. Moreover, you won't have to restrict fluid intake.
Yes, that would be great and really helpful. Thank you.
You're welcome. Do you have any further queries about what we have spoken today?
No. I am relieved that it's treatable. I will see you tomorrow.
Sure, we'll see you tomorrow. Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.